Hi friends, welcome to the last part of PV discharge. So this will be the last part so that you know uh, the various causes. So in first video we discussed about what are the various causes for PV discharge and what discharge can come. It can be blood, it can be mucus, it can be watery fluids, all those things. And also we discussed something related to statistics. Now in second part we discussed more about infection. Now I am still further going more deep into the infection per se so that you have an idea when to suspect what are the causes. Okay, this please correlate with this video with the lower abdominal pain approach so that you have a proper idea. Okay, now let me talk about this video is very short. You will just learn about what are the various types of discharge you get in infectious causes. So if it's an infectious cause and you are getting these kind of discharge, suspect so and so pathologist. Okay, first thing is white. This should be a two-way approach because everyone know it's more of micro. If it's white, curdy and thick, then it's most likely yes, candidiasis. Why? See, you must know the reason for everything. Okay, otherwise there is no point in learning. Why do you think you have to just buy hard things? No, you should not. So white because of candida albicans produce as a pigment which is white in color. Okay, that's it. That is about white curdy discharge. Now the second discharge which you can get is, which was the first most common thing in bacterial vaginosis, right? So you have something called as thin fishy odor discharge. Okay, and this will be kind of mild to moderate. So if you are getting something related to this, then you have to suspect bacterial vaginosis. Now just revise Amsler's criteria. What does it say? That one is of KOH test, then clue cells, then about pH greater than 4.5. This is very very important because 50% of case is something which you see in your infection is this, so you should know this, and 25% is about candidiasis. Now you know white in fishy odor because of the bacteria which are present, and this is called as what the name of the test. Yes, you will write it in the comments. Is it shift test? Yes, that you will let me know. So 75% of infectious discharge you are now able to find out. Next you have something called as what? Green frothy discharge. Okay, this you find in trichomonas vaginalis. This is a sexually transmitted infection. Okay, now one important thing which I would like to say, see, you saw the discharge, but I would like to do a per speculum examination, and if you see a strawberry cervix, okay, and it's most likely trichomonas vaginalis. Okay, cool. Next, last one. If it's yellow, okay, then most likely it's gonorrhea. Cool. So these are the major discharge which I wanted to talk about. Now coming to what do you want? Treatment, no? Or in investigations you want to know? Investigations, let me touch upon so that you have a little idea. So again, primary healthcare approach and a tertiary healthcare approach. In primary healthcare approach, you give what is that? Packs. That I will talk about this later. First I will come to investigation. So basic investigations is your culture. If you want, you can give. Okay, and any It's almost a clinical diagnosis just to confirm it. And for antibiotic susceptibility, you do the cuts and basic CBC to look for infection. You can do left to treatment. Treatment most likely here it is antibiotics. Okay. Uh, in all these cases, especially in candidiasis, you give cotrimoxazole. Okay. Remaining here, most likely metronidazole is what we prefer. Metronidazole. Okay. So now you know the treatment. If all these things are present, no, one more important thing, all these things are present with fever, most likely it's a pelvic inflammatory disease. Okay. See, why do you think I am talking? Why do you think I made 2 videos for infection? Do you think I am mad? No. See, what are the complications of a PID? See, if she is a reproductive age woman and if she has PID, no, then what if it is a salpingitis? So that is most important. See, if it's an infection, I want to take about this statistics also. If it's an infection, okay, let me write it in bold color because it's very important. If it's an infection, no, yes, most common is vaginosis. But if you have not treating it properly, no, the most common complication is the most common infection is salpingitis, which accounts for more than 40 to 50% of case. Remaining all are there, uveitis, then endometritis. Okay, these are also complications. But what is the problem if it's a salpingitis, guys? See, if it's a salpingitis and if she's a reproductive age woman, okay, and she has not had pregnancy before, this infection has the ability to destroy the cilia. Okay, let me draw it for you. See, think this is a tube and here you have normal cilia, right? Now you have destroyed the whole cilia. Okay, now what happens? There is infection. Okay, so let me use a yellow. Okay, so infection, so that will destroy your cilia. Now think she conceives after many days. Okay, there is no proper beating of cilia to move the zygote, so there is a high chance of ectopic. This is the major worry complication for us, correct? No, that's why we treat it aggressively. So again, infection, you have STI and non-STI. If it's STI, then again you can transmit it, so you are increasing the disease burden, correct? No, so that's why the major thing. Now let me talk about the parts. So in gynecology as such, this majorly will learn in dermat, but in gynecology I would like you to remember only 3 packs. That is 1, 2, 6. 6 is for, see, 6 is a large number, correct? No, so it's for large disease. What is that? Pelvic inflammatory disease. Okay, this contents you will write it in the comment section so that it's an active class. Okay, what do you think 1 is for? Yeah, 1 is for vaginal, 2 is for cervicitis. So these are this where do you use? This you use in a primary healthcare support center where you don't have access to all the medicines as such. So this is where you make use of that thing. Okay. This is the major. So per vaginal discharge in a broad aspect, we discuss what are the major causes of it, when it is physiological, and age specific things we discuss, and we discuss a lot about infection because that is because complication of it is very very fatal. And also we discuss about packs. Okay, majorly speaking, especially the packs as such is very very important because that is what is tested even in your NEET PG as well as I think you would have learnt it in community medicine as well. So that's it. If you have any doubt, make sure you put it in comment section so that I know what is the problem. I mean, what is the exact problem. Okay. uh, One more thing, please, this pack one is for, sorry, I'm sorry, pack one is for cervicitis and pack two is for vaginitis. I'm sorry, my bad. Excuse me for that. Okay. That's it. Thank you.